Yo, dead.
Just know it. Because remember, we have to put you live. So I have to send me link.
So just do that.
Huh?
Just do that.
But not that I do it now, but
Chad, do you he would stop and kiss me?
yes, you realize.
This scope trip coming up.
Okay, send the link for Nigeria.
One night, the man didn't want to make the 50 sign for me. So
Remember,
it was,
when you get another chance.
yeah, after it's unveiled.
Yeah, I can hear you in the headphones. Yeah,
We live. I don't know if Nigeria put all it on yet, but
Find out from Nigeria, call him.
yeah, that's what I just. Wait now. Look scary, church.
Yeah, and they're going to start.
yeah, we can go ahead.
Hey, we ready? Yeah.
We're 4 minutes. Okay, yeah.
Hey, Nigel. Hello. You on? You on? Okay, good. All right, cool. To the official commissioning of the Georgetown Portsmouth Health and Wellness Center. Today is the first day of March 2021, and we're here for the second commissioning, the first being the commissioning of the Elizabeth Murphy Health and Wellness Center in Maho last Friday. Today, the chairperson for the event is the acting permanent secretary in the Ministry of Health, Wellness and New Health Investment. And also you will expect addresses from the parliamentary representative, the Minister for Health, and as well as Prime Minister Honorable Roosevelt Skerrit. The Prime Minister has arrived, and very soon the program should begin here. The official commissioning of the Georgetown Portsmouth Health and Wellness Center. Portsmouth
us pray. Father, in the name of the Lord Jesus Christ, we want to say thank you, first of all, for this beautiful day that you have so designed for us. We thank you, my God, for all that will be taking place on today. We ask for your wisdom, your blessings, your favor, your grace. We pray that you would order the ceremony today, my God, in accordance, oh God, to your will and plan and purposes. We thank you. We pray, Father, that everything that will be done today, Father, will serve the purpose for which it was designed. We bless you, we thank you, and we glorify you. In Jesus' name we pray. Amen.
Please be seated. Good afternoon to everyone. I would like to recognize the presence of the Honorable Roosevelt Skerrit, Prime Minister and Minister for Finance, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and Parliamentary Representative of the Portsmouth constituency, other honorable members of Cabinet, permanent secretaries, Mrs. Kerry Prince, Mayor of Portsmouth, Mr. Ahmad Al-Khatib, Project Manager, MMCE, staff of the Portsmouth Health District, as well as other staff of the Ministry of Health, Wellness and New Health Investment, Pastor Joseph Benjamin, members of the Commissioning Committee, Ms. Olivia Douglas, other invited guests, members of the media, ladies and gentlemen, both present and those listening via the various media, welcome and good afternoon. I would now like to invite Mrs. Kerry Prince, the Mayor of Portsmouth, to do the welcome remark.
Good afternoon. Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica. Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment. Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and Parliamentary Representative of the Portsmouth constituency. Other honorable members of Cabinet, Ms. Karen Prevost, Acting Secretary to the Cabinet, other permanent secretaries, Mr. Hamid Al-Kahib, Project Manager, MMCE, Mrs. Terelia Ravalier, Acting Principal Nursing Officer, Mrs. Teresa Andrew, District Nurse Midwife, Pastor Joseph Benjamin, other invited guests, members of the media, ladies and gentlemen, good afternoon. Today, we celebrate the grand opening of this newly constructed state-of-the-art Health and Wellness Center in our town, Portsmouth. Looking back at what we have achieved over the years, in so many ways, points to a bright future. Let's take a walk back to when our health center was located in Zikak, where the fire station is currently located. Then, we upgraded to the RFA Hospital in 1993, where the health center was located for some years. And now, we have advanced to this ultra-modern Health and Wellness Center here in Georgetown. This indeed speaks volumes of development in the town of Portsmouth, and it's with distinct honor and gratitude on behalf of the people of Portsmouth, that we offer all thanks to God, the government of Dominica, and MMCE for making this a reality. We all know this common idiom: you can lead a horse to water, but you cannot make it drink. Let us embed this in our minds today. The advantage or this opportunity was given to us, the people of Portsmouth, but the government nor the Ministry of Health can force us to embrace it. We have to make a conscious decision as a people to act responsibly and take care of this facility so generations to come can enjoy its services. Once again, thank you for coming and have a blessed afternoon.
Thank you very much, Mrs. Spring. I now invite Mr. Ahmad Al-Khatib, Project Manager from MMCE, give a project.
Good evening, ladies and gentlemen. I hope everybody's doing all right. First, allow me to recognize a few people on the podium. I recognize Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica, Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and Parliamentary Representative of the Portsmouth constituency, other honorable members of Cabinet, other permanent secretaries, other invited guests, members of the media, ladies and gentlemen, good afternoon. We are gathered here today to celebrate and tick off another project with the handing over of the Georgetown Health Center, similar to what we did on Friday in Maho, and we will be doing during the few upcoming days. The scope was made clear from the get-go when the government of Dominica has emphasized the need to update the health facilities around the island, especially after the passing of Hurricane Maria. Thus, we have been trusted with developing and building 12 health centers throughout the island. As you all are aware, Georgetown Housing Scheme started in July 2018 and was concluded on the 20th of January 2020 with the formation of 68 units. And now we hereby present you with the health center, thus serving the community and its surrounding. Please allow me to brief on the progress of the health centers as of today, 12 of them. We have completed 8 health centers, namely Maho, you've seen that on Friday, Bellevue, Bagatelle, Georgetown, the one we're presenting today, Penville, Wesley, Marigot, and Vekas. As for the last 4, we're expecting completion for Solihull in April this year, October for Newtown and Soufriere, and May for Anstey May. Let's talk about these health centers. These health centers will transform healthcare in Dominica, as they will empower and engage the communities through the availability of local healthcare options. In compliance with this government requirements and specifications, these health centers are fully equipped for your everyday healthcare needs and convenience for the handicapped and elderly citizens. The latter was made a priority on this project by the government. The structure, built by a Dominican contractor, Robbins Construction, a reinforced structure to tackle climate change and the harsh effects of hurricanes. The evidence all point out that concrete is the best way to tackle these adverse weathers. Equipped with impact-resistant windows, we have also considered the possibility of adding shutters to secure both facilities and the residents of the centers during these harsh weathers. The health center consists of, starting with the ground floor, a doctor's office, nurse offices, 2 examination rooms, 2 clinics, and a pharmacy. As for the upstairs, the living area for the nurses consists of 2 bedrooms, a kitchen, a living area, in addition to the sizable balcony that you see. I would like to thank a few people as it is the case on every project, a project is a teamwork. It's a teamwork-oriented project. And we have to thank the local contractor who built this structure, Robbins Construction. Thank you. You've done a proper job. A proper job. We also cannot forget the competence and the work and the cooperation of the utilities companies, namely Duasco, Domlec, and Digicel for telecommunications. And we have also need to show our greatest gratitude to the Ministry of Health for their cooperation and constant feedback and recommendation. Without this project would have not come into fruition. Finally, I reaffirm the importance of our partnership with the government of Dominica on implementing these health centers, and we look forward for more future projects and developments. Thank you for coming here today and sharing this moment with us, and have a good evening.
Thank you, Ahmad. We now continue with the program, and I would like to invite Mrs. Terilla Ravalier, Principal Nursing Officer, to read the citation for the official naming of the Health and Wellness.
Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica. Honorable Dr. Irving McIntyre, Minister for Health, Wellness, and New Health Investment. Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and Parliamentary Representative of the Portsmouth constituency. Honorable Members of Cabinet, Mrs. Letitia Lestrade-White, Permanent Secretary, Ministry of Health, Wellness, and New Health Investment. Other Permanent Secretaries, Mrs. Kerry Prince, Mayor of Portsmouth, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Mrs. Teresa Andrew, District Nurse Midwife, Pastor Joseph Benjamin, other invited guests, members of the media, ladies and gentlemen, pleasant afternoon to all. Nurse Olivia Douglas. Mrs. Olivia Douglas, also known by many as Nurse Douglas, a Jamaican national, arrived in Dominica from England with her husband, the late Honorable Michael Douglas, and their young son, Robert Douglas. Nurse Douglas, who at the time was a very young nurse, joined the health team of the Portsmouth Hospital, where she worked for several years, rising to the rank of departmental sister. As a departmental sister, Nurse Douglas was responsible for the supervision of the hospital. Nurse Douglas was a pioneer of the primary healthcare revolution of the 1980s. She was responsible for several deliveries at the then maternity ward of the Portsmouth Hospital. And during that time, she coached and gave direction to the staff she supervised to ensure that they delivered quality care to all the patients. In 1985, Nurse Olivia Douglas was transferred to the Princess Margaret Hospital Nursing School in Roseau. After being assigned to the School of Nursing as a tutor, Nurse Douglas, who worked under the leadership of Sister Agnes Brooks, who was the principal tutor, along with her colleagues, Nurse Angela Lawrence, Nurse Fiona Frederick, and deceased Nurse Eugenia Elwin, to name a few, was actively involved in training of the nursing students at the then Princess Margaret Hospital Nursing School. Today,
Nurse Olivia Douglas can proudly boast of her contribution, since many of those whom she tutored are currently practicing in the public service at the Portsmouth Hospital and the now Dominica China Friendship Hospital. Some of the nurses have also moved on to assume positions at administrative level as well. Nurse Olivia Douglas retired from the profession after the untimely death of her husband, but continued to provide guidance and counseling to everyone on the issues as it relates to health and wellness. In 2006, Nurse Olivia Douglas, having rendered over 40 years of faithful and dedicated service in the field of nursing in the Commonwealth of Dominica, received a Meritorious Service Award for persons who have rendered meritorious service in the Commonwealth of Dominica, and was awarded the Medal of Honor in recognition of her service. The Ministry of Health, Wellness and New Health Investment, on behalf of the government of the Commonwealth of Dominica, on this day, March 1st, 2021, hereby declare that the new Portsmouth Health Center be named the Olivia Douglas Health and Wellness Center. The ministry congratulates Nurse Olivia Douglas and expresses thanks for her contribution to both primary and secondary healthcare services, to include nursing education in the Commonwealth of Dominica. I thank you.
Thank you, Mrs. Ravalier. I want to take this opportunity to extend my personal congratulations to Mrs. Douglas. Mrs. Douglas, when I entered the profession in 1988 under the collegiate type program, Mrs. Douglas was one of my tutors. So I want to extend my congratulations, because it's persons like you who help us to become who we are. Congratulations again. I now invite Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and the Parliamentary Representative of the Portsmouth constituency, to give remarks.
Thank you very much. P.S. Honorable Dr. Roosevelt Skerritt, Prime Minister of the Commonwealth of Dominica. Honorable Dr. Irving McIntyre, Minister for Health, Wellness and New Health Investment. Mrs. Letitia Lestrade White, Permanent Secretary in Ministry of Health. My cabinet colleagues who are here in full force this afternoon. Mayor of Portsmouth, Her Worship Kerry Prince. Project Manager of MMC, Mr. Ahmad Al-Khatib. Pastor Benjamin. Distinguished guests, ladies and gentlemen, good afternoon. Let me first of all congratulate my mother on being awarded or being afforded this accolade this afternoon. Congratulations. And again, we see history is being created by this revolutionary government. It should be clear to everyone now that healthcare is one of the top priorities of this government and has ever been since we started off in 2000. We believe that a productive workforce brings about or allows or can only happen if you have a healthy population. And this is why we never spared any effort to continuously ameliorate and upgrade the medical infrastructure and the human resource of our country. We are focused on every facet in the spectrum of healthcare to our people, from the nursing school being merged to the Dominica State College, to taking ward aids right up to RNs, registered nurses, and taking registered nurses up to the bachelor and master's degree and other specialized fields in the nursing service. We have educated more medical doctors and we have trained more specialists than ever before. With the help of the Bolivarian Republic of Venezuela, we created first the diagnostic center at the RFA hospital in Portsmouth, and we have created several smart centers around Dominica. We are presently doing a series of functions like this type to open 12 new health and wellness facilities around Dominica. Dominica has always had a stellar reputation for healthcare in the region. In the 1980s, we were envied by all our counterparts in the region for a first-class primary healthcare system. And this suite of new health and wellness centers are just the right step in the strategy for helping us to get back to that position in the region and the world. The primary healthcare system is the first line of defense in the maintenance of good health and wellness. These health and wellness centers will be a fortress in our fight to encourage and motivate healthy lifestyles in our population. These centers are meant to keep us out of the type 1 facilities. We all know that the chronic non-communicable diseases are the number one reason for the high sickness and death rates among people in the region today, which undermines the economic and productive prospects of our nations. These health and wellness centers are our garrisons in the war against CNCDs. From the baby to the elderly, we need to get the education and sensitization we need to lead healthy lifestyles. Because usually, when you go on to use those medicines, they cannot cure the chronic conditions. They can only help you to control them. And for us in this government and the Ministry of Health, prevention has always been better than cure. A stitch in time saves 9. This philosophy was made very evident in our handling of the pandemic. And this is why we are the envy of the world today, boasting more than a 90% recovery rate and no COVID deaths to date, knock on wood. Healthcare was and will always be a community effort. We embrace the directives of the government and obediently adhere to the health protocols put in place by the government from day one to curb the possibility of infection and transmission. For the most part, the population have been absolutely cooperative. We all need to celebrate our success as a nation so far. The brilliant initial handling of the control of the COVID-19 pandemic has helped us to seamlessly transition to the inoculation stage of the process. Firstly, how did the Prime Minister have the foresight and vision to ask Dr. Irving McIntyre to run for elections, and not only run, but join him in the new cabinet of ministers as the Minister of Health, Wellness, and New Health Investment? And what moved one of the most successful medical practitioners in the country at the time to sacrifice his lucrative medical practice to serve his fellow men for a pittance of what he could make in private practice? And this is why we have always told you that we are here to serve, not to be served. We are changing the socio-economic landscape of this country, one community at a time. Look at the fabulous houses that we have been able to provide for our citizens here in Georgetown and all over Dominica. Those of us from this area cannot even remember what Georgetown used to be just a few short years ago. This place has been totally transformed into one of the most impressive housing development areas in the country today. Foreign political parties are asking their governments, why can't they do like the government of Dominica? Why can't they use their citizenship programs to do what the government of Dominica is doing for its citizens free of charge? From houses to hotels to health and wellness centers, roads and bridges, sea and river defenses, this country is being transformed one community at a time. Where our old health center used to be, like the mayor just alluded to, now stands a new fire station. The Mang has now become the Benjamin Spark, lit with new stands, and the traffic congestion in Portsmouth Central is now alleviated. Farmers and fishers now have equipped facilities for the processing of their fresh fish and food. Our education and recreational facilities have been renovated, rehabilitated, rebuilt, and expanded. And the new world-class hotels have been created right here in our communities. Our waterfront has been cleared of all the wrecks, and our yachting sector is recovering from a very challenging period caused by the pandemic. So I remain optimistic that the only place to go from here is up. As the vaccine continues to take root, the restrictions around the world should ease and people will want to travel again. And we in Dominica will be one of the most sought after destinations to visit in the world, I am sure. So let this small ceremony be a very significant one here today in Georgetown, in the heartland of the Dominica Labour Party. I thank you very much.
Thank you, Honorable Douglas. I now invite Honorable Dr. Irvin McIntyre, Minister for Health, Wellness, and New Health Investment, to give remarks.
Thank you, PS. Let me first acknowledge the presence of the Honorable Prime Minister, Dr. Roosevelt Skerrit, Senior Minister Reginald Austrie, Honorable Ian Douglas, Minister for Trade, Commerce, Entrepreneurship, Innovation, Business and Export Development, and Parliamentary Representative of the Portsmouth constituency, other members of Cabinet, Mrs. Letitia Lestrade-White, Permanent Secretary, Ministry of Health, Wellness, and New Health Investment, other permanent secretaries, Mrs. Kerry Prince, Mayor of Portsmouth, Dr. Ahmed Al-Khatib, Project Manager, MMC, Mrs. Terilia Ravalier, Acting Principal Nursing Officer, Mrs. Teresa Andrew, District Nurse Midwife, Pastor Joseph Benjamin, other invited guests, members of the media, ladies and gentlemen, pleasant good afternoon to you all. We're here again this time not to inspect and to assess the progress of your new Health and Wellness Center, but for the commissioning of your new Health and Wellness Center. You have been patient, and that's a virtue. Today, you have a beautiful facility, literally in your front yard, a structure that is not only pleasing to the eyes, but one that meets all international standards, one that fits in with our vision of being the first climate-resilient country. That is a structure that is able to withstand adverse climatic events such as hurricanes, such that after a hurricane, your services will not be interrupted. And importantly to know, a structure that was built by a Dominican contractor. That's about the structure. But you, the people, are the heartbeat of this facility. You are the pulse of this facility. You are the ones to make it work for you. The new health center is built for you because this government puts you first in everything that it does. You have had a long, genuine, fruitful relationship with this government, from Honorable Michael Douglas to former Prime Minister Rosie Douglas, and to the present-day Parliamentary Representative Honorable Ian Douglas. You have been faithful, and we now show you our appreciation by delivering to you, the people, your new Health and Wellness Center. I must also inform you that you have an important role to play in the success of this new facility. From this new facility, we must see a healthier community with increased productivity. We want to see less complications of the chronic diseases such as amputations and blindness due to diabetes. You must attend your clinics. You must listen and take advice of your healthcare workers, that you will not only help yourself and the community, but you will also ensure the legacy of Nurse Olivia Douglas, who has done so much for health in this community. You must not only see today as the commissioning of your new Health and Wellness Center. It is part of a series of things that has been going on in this region for your development. Whether it's the five-star hotel development like Kempinski, and Aniki soon to be opened, as well as other guest houses, inns, and restaurants. Also the housing revolution in Cotton Hill and here in Georgetown. Soon to open the Dominica University of Medical Sciences. They are all these are the determinants to elevate you, the people of this region. You must cherish your new health center. Take good care of it. Keep the surroundings clean. Don't litter. Don't deface it. It belongs to you. Special thanks to the commissioning committee here today and to MMC for a job well done. I would also want to mention our vaccine rollout and program which started 2 weeks ago. We are very pleased with the turnout so far from this district. However, we are urging those of you who have not received your vaccine to please do so. And those of you who have received your vaccine, please encourage your friends, your loved ones, and your neighbors to do so as well. The only way the country can get back to being normal again is if we all get vaccinated and protected from COVID-19 disease. You want your hotels, your yachting activity, your tourist activities, your opening of your university, your sporting activities to recommence. And this will recommence when we attain normalcy, which we expect after we've all gone through the vaccine program. And for this to happen, we must take part in this program, this vaccination program. Also remember that while the vaccination program is ongoing, we should continue all our public health and social measures. That is wearing our mask in public places, frequent washing of our hands, and frequent cleaning the surfaces that we touch very often. The battle is not over, and we must continue all these public health and social measures. I thank you, and God bless you.
Thank you, Honorable Minister. I now invite Miss Angel Joseph to do a performance, followed by the St. John's Academy. So after Miss Joseph completes her performance in St. John's Academy, you are up next.
Good afternoon, everyone. There's a hero when you look inside your heart. You don't have to be afraid of what you are. There's an answer when you reach into your soul, and the sorrow that you know will melt away. And then a hero comes along with the strength to carry on. Then you cast your fears aside, and you know you can survive. So when you feel like hope is gone, look inside you and be strong. And then you finally see the truth, that a hero lies in you. It's a long road when you face the world alone. No one reaches out a hand for you to hold. You can find love when you look into yourself, and the emptiness you felt will disappear. Oh yeah, hero comes along with the strength to carry on, and then you cast your fears aside, and you know you can survive. So when you feel like hope is gone, look inside you and be strong, and then you finally see the truth that a hero lies in you. Oh, Lord knows the dreams are hard to follow, but don't let anyone tear them away. Just hold on, and there will be tomorrow, and in time you'll find the way. And then a hero comes along with the strength to carry on, and then you cast your fears aside, and you know you can survive. So when you feel like hope is gone, look inside you and be strong, and then you finally see the truth that a hero lies in you.
Thank you, Ms. Joseph. I think we need to give her another round of applause. St. John's Academy. Thank you, St. John's Academy. Many of us at this age, we are afraid to go and perform in front of the crowds. Please put your hands again together for St. John's Academy. Okay, I would now like to invite Honorable Roosevelt Skerrit, Prime Minister and Minister for Finance, to do the feature address. Go ahead. You want to take them off? Okay, St. John's Academy, our apologies, we thought you will finish. Can you come and take the floor? That's okay. Thank you, St. John's Academy. I now invite the Honorable Roosevelt Skerrit, Prime Minister and Minister for Finance, to give the feature address.
Thank you very much. Let me first of all recognize in our presence our mates, Honorable Reginald Ostry, our Senior Minister, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investments, Honorable Ian Douglas, our Minister for Trade and our Parliamentary Representative, my other Cabinet colleagues present. Let me also especially recognize Nurse Olivia Douglas and to extend my congratulations as well. The Permanent Secretary and Minister of Health, other Permanent Secretaries, our dear Mayor of Portsmouth, Mrs. Carrie Prince, and other councillors, Mr. Ahmad Al-Khatib from MMC and MMC staff present here, our Acting Principal Nursing Officer, our District Nurse Midwife, our Pastor who prayed for us, Pastor Benjamin, other invited guests, members of the media, ladies and gentlemen, friends all, good afternoon. I first want to express my own personal congratulations and that of the government to Nurse Douglas, as we know, for having been bestowed this honor of having the Portsmouth Hospital, Health Center and Health and Wellness Center named in her honor. And so we shall refer to this facility as the Nurse Olivia Douglas, or Nurse Olivia Douglas Health and Wellness Center. I saw you know as nurse. I always put the nurse before. I think they should have put the nurse before, you know. Because it would be difficult for those of us who know Nurse Douglas to say Olivia Douglas and not Nurse Douglas. But it speaks to an extraordinary level of commitment and service to our country. That Nurse Douglas, who was not born in Dominica, but no one would not know she was not born in Dominica because of the way she has conducted herself as a citizen and resident of our country. I am fortunate to have had interactions with Nurse Douglas over an extended period of time, and I have seen her work. I remember we called her out of retirement to assist us when we were having our health challenges. And she was moving around as if she had just graduated from a nursing school, with the energy and the zeal and the love and the commitment, and above all the professionalism that are so important in the delivery of services and our interaction with human beings. Because a nurse's responsibility is only to administer medication or to dress ulcers, but it's also to let people feel loved and cared for. And I think this, above all, as the Bible says, love is the most important of all. And we have to have that genuine love in our hearts and in our minds and in our spirit if we are to really let people feel loved and feel better. Sometimes you, as a nurse, may not have done anything for the person other than showing the person that you care and you love the person, and immediately the person gets better. You know, so we have to emulate the legacy and the contribution of people like Nurse Douglas to Dominica and to the health sector in Dominica. And Nurse, we're really proud of your achievements, and we're very grateful of your contribution. And this is a way of the government, on behalf of all of Dominicans, saying thanks to you. Thanks to so many decades of service to Portsmouth and in Dominica. And you have not gone into retirement and stay home and watch TV. No, you've been very much involved in the community, in your church, the calls. You cannot talk about calls and not talk about Nurse Douglas. And it speaks to those things in us that we are part of the society. And if we want the society to be better, the question is, what are we going to do to make it better? Are we going to sit at our homes and criticize? Or are we going to put our hands to the plow and work and join forces with each other to make the society better? And if there's one example, and there are many examples in Portsmouth, but this one example in Portsmouth that we all should look to is Nurse Douglas and her contribution and professionalism and the love and the commitment to the job. So I really wanted to be here in this, Douglas, not necessarily to officially open this health and wellness center, but to be there to recognize this historic moment of the government recognizing you for your service to Dominica and to the health sector. Now, we in Dominica, we've seen many things happen in this country over the last 20 years. And we have gotten so accustomed to many developments in this country that we appear to be taking them for granted. It is not too long ago, it was in 2005, that we had our first intensive care unit in Dominica. And I never realized this, that we never had an ICU before 2005. And when I found this out, they said, well, how can we have a hospital and not have an intensive care unit? And when we look at the number of people who have gone through this ICU since 2005 up to today, I am asking myself in my own personal reflections, what happened before that? And then we are seeing these facilities being built, taking all of the modern elements into consideration, all of the resilience characteristics into consideration. But more importantly, building facilities that are user-friendly, that can encourage people and motivate people to come to get the services. And if you realize what we're doing now in the government and the Ministry of Health is that we're not only calling these things health centers anymore, no. It is a health and wellness center. And we want to stress on the word wellness, because we don't want people to only come to the health center when they have something wrong with them. We want them to come to these health and wellness centers to get educated and informed on how we can take care of ourselves and prevent ourselves from getting sick. And that is what we need to speak about at this health and wellness centers. As the minister and others have indicated, we are building 12 of those. And I know I have a request from Clifton, from the powder from Clifton, for a new one in Clifton, and I am sure when I go back to Roseau and I speak to the Minister of Finance, he'll be more than willing to give consideration to this new health center in Clifton. And we will build in a new health center for Roseau itself, because where Roseau is really an infant school, and it has outlived its usefulness. And so we'll be building a new health center in Roseau to serve this part of the country. And we're not building something nicer in some other part and something less nice in another part. If you realize we're doing the same thing across Dominica. Same thing for the housing. If you go to Lapland, you will see these very same buildings in Lapland. If you go to Roseau, that's where we're in Roseau. In Massac, in Jimmet, and elsewhere. Ensuring that we let Dominicans know we are all equal. And we're all entitled to the same that everywhere else in the country is receiving. So this health and wellness centers is part of the government's strategy to continue to improve the healthcare services in Dominica, to improve the delivery of healthcare services. And so, yes, we have these physical facilities, but we need to ensure that the services that we receive are up to the level that is satisfactory to the clients who will come in there to receive care. And so we are building the Marigot Hospital that will be completed sometime in April, June of this year. And we have the Dominica China Friendship Hospital. We have the MRI in place, but because of COVID and traveling challenges, we have not been able to get the technician to come in to train the people to use it. And that would be a significant improvement in the services that we offer to our citizens. No longer will we have to go elsewhere to get an MRI done in Dominica. In all parts of the world, we do it here in Dominica. and the number of additional services that we'll be offering at the Dominica China Friendship Hospital. And the Parliament for Portsmouth spoke about the training of doctors, the training of nurses. And he indicated we have more specialists now than we ever had. And not the very important thing, local specialists, Dominicans. And when we speak about our fight of COVID-19, it is not by accident that we are where we are in terms of our success thus far. We credit ourselves as citizens for the manner in which we have conducted ourselves, adhering in large part to the COVID-19 protocols and guidelines. But it speaks to the very strong primary healthcare system we have in Dominica. That's part of the reasons why we have been so successful with fighting this, because you would only fight it at the tertiary level, you fight it at the local level, at the primary level. And this is where we have been very successful as well with fighting COVID-19. And so with these new health and wellness facilities, we will be even redoubling our efforts at the primary healthcare system. Because we should not only be preoccupied with treating people who get sick, we have to prevent people from getting sick. Because the cost of management of CNCDs in Dominica is astronomical. I believe more than 25% of our pharmaceuticals, our bill, is to treat CNCDs in Dominica. And it's increasing. And when you have a situation, and this is why we are placing so much emphasis on CNCDs, and it's so important for all of us in Dominica, every citizen, every resident, to take note of this and what we can do to prevent ourselves from getting hypertension and diabetes and others. When you have in a situation the breadwinner of a family, he's 43 years old. And he suffers a massive stroke. He can't work. You understand what that means for the family from an economic and social standpoint. Or you have a family, a lady 50 years, she has 4 children, she is diabetic, may not be managing it properly. Because we drink all sorts of juices, because we have money these days in Dominica, so we can buy juices. We cut all the guava trees, we cut all the cherry trees, we cut all the soursop trees, and the box drink we like in Dominica. And that's what happens when there is progress. People have money and they go and buy things rather than growing things in their yard. Most people don't have a little chicken laying eggs under the house anymore. People, you always buy the egg now if you live in the liquid form, in a box. So you just pour this in the frying pan and hey, voila, you have an omelette. We don't see spinach. Spinach used to be in everybody's yard in Dominica. And every day you go and you cut some branches and you cook. We have spread this through Gramoxone and all the other weedicides. And then we put concrete in our yards and crazy tiles. Now I could have come here and speak about economics and finance and all these things. But these micro things are very important in our fight against CNCDs and our practices. So we have to reflect, and this is why I want us to not focus on health center, but focus on the wellness part of this facility. What can I do to prevent myself from getting sick? And come in there and ask nurse a question, ask the nurses questions, ask the doctors questions about this. Because we have to find a way of reducing on this cost, the cost of treating hypertension, diabetes, and other CNCDs. Even in children, we have a growing incidence and rate of diabetes. And those things can be prevented by our own practices. And so we will continue on our efforts to improve the delivery of health care. Health, as the Parliament indicated and the Minister indicated, is priority for this government. And it has always been a priority of his government. Our party recognizes that, and this is part of our strategy as a party. Whether we're in government or not, this is why back in the days when Rosie Douglas would bring in doctors from Guadeloupe and medicine via Ansdeme and move around with doctors and treat people. We would take people on the fishing boats and take them to Guadeloupe and Marigoland to get treated back in the days. So we've not been doing so only because we're in government, we've been doing so because philosophically and ideologically, our party believes in education and believes in the health of our people. This is why we have almost achieved universal access to health in Dominica. Now, everybody 18 and younger has access free of charge, and everybody 16 over have access free of charge. Now, for those of you in that category, in those two categories, it is free to you, but it is not free to the government. We have to pay. And so we have to recognize those things and to give God thanks for so many blessings we have in this country. And we speak about vaccines. It is important for us to take the vaccines. And people say, well, we have no COVID in Dominica. All the COVID we have is in the airport. We pick them up and then in the COVID center. So why take the vaccines and so forth? It's an important defense mechanism for us. We should not wait for us to get it and then say, wait, the vaccine. We have an opportunity, thank God, that we can take it in a preemptive, proactive manner. And my question is, if we hadn't gotten vaccines and everybody is getting in the Caribbean, so they say, where's carried contacts now? So long, Prime Minister, you can't get 2 vaccines in Dominica for us and so on. You know us in Dominica already, you know. And then we have vaccines. I think tonight, 20,000 doses are landing in Dominica again from China. So we have vaccines to vaccinate the population. And I was just saying to the Minister of Health, and I'm not sure whether they're going to give us a prize for that in the Vegas constituency. But they were the health center in Vegas, and they vaccinated 267 people in the constituency today, in one day. And I want to commend my constituents for availing themselves to get vaccinated, and that's in addition to the number of them who went to Portsmouth last week to get vaccinated. It's because we're pushing in the Vegas constituency to get herd immunity as quickly as possible and so on. And then whenever you guys come in my constituency, you're going to have to get the vaccines before you can come in the Vegas and so on. But the reality is, my friends, on this vaccine thing, mark my word, you'll be required to show your vaccination passport when you're going to travel, even in Caribbean countries. And then some of you who do not want to take it, you're going to WhatsApp me and tell me, Scary, I'm going to travel next week on the vaccine, please, 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 please. And I'll tell you, no. Let's take it now, my friends. We have the opportunity, let's take it now. This is not an ideological debate. This is not a religious debate. This is a debate about our safety, our welfare and well-being, and that of our families. And so let us avail ourselves to this. But we want to commend and to thank MMC for the continued partnership. It's a partnership that has worked well for the people of Dominica. And of course, the utilization of the citizenship by investment funds. The strategic manner in which we've been using the funds to make life better for people, not only socially, but economically, by investing in agriculture, by investing in hotels, by investing in small businesses, by investing in agriculture, by investing in infrastructure to facilitate trade and commerce, by investing in education, investing in healthcare, investing in housing, paying some of our of our high debts or high interest rate debts, to reduce on the need for us to be paying interest rates every month and every year. We have a model here in Dominica in terms of the utilization of the funds. And so it is in our interest for us to continue to promote and to defend the Citizenship by Investment Program. Anybody who is seeking to undermine the CBI is an enemy of the state. It is simple as that. Because we understand and appreciate how important that is in Dominica. And you know, at the time the Hurricane Maria hit us, we were saving. And we had over $300 million saved from the CBI. That's what we were able to use to clear Dominica, and get things moving as quickly as possible, because the help from overseas was taking some time to come. Prudent management, responsible management of state resources in a practical and pragmatic way. And here in Dominica, with all of the challenges we have been able to take care of our people in Dominica. Take care of our people. So I'm very happy to be here. The most important part of my presence, as I said, is to celebrate with Nurse Douglas on this achievement, on this recognition, and to personally thank her for her service to Dominica and to Dominicans over so many decades, and to celebrate with the Portsmouth people for this facility. And I will say to you, my dear friends in Portsmouth, you're going to see more of these buildings coming to Portsmouth very soon. These homes, these residences in Portsmouth. And very soon we shall roll out an additional significant number to provide improved housing for the people of Portsmouth. So let us prepare ourselves, ladies and gentlemen. Let's work together. We are in a global pandemic, a time that requires unity of purpose. That's the only way we're going to see ourselves through this very challenging period, by working together, by seeing the glass half full and not half empty, and by always looking out for the less fortunate, our neighbors. Being our neighbor's keeper in a practical and sincere way, expression of love and caring to our people. This is how we're going to see ourselves through. So I want to congratulate the Minister of Health, the Minister, his staff, and of course everyone who worked to ensure that this facility was built and is now at the disposal of the people of Portsmouth. And I want to thank the nurses, and in particular our district nurse there, Mrs. Andrew. And being from where she is from, I'm sure she'll continue to provide the care for the patients in a very loving way, very caring way. And I know that's what she's been doing, and no doubt she'll continue, especially with this new facility here in Georgetown, Portsmouth. I wish all the nurses and doctors well. This is our country. And I always say to doctors and nurses, today we are the one administering the care. Tomorrow we might be receiving it. And let us do unto others as we like them do unto us. Thank you very much. God bless you.
Thank you, Honorable Prime Minister. I would like to invite now Mrs. Teresa Andrew, District Nurse Midwife, to give a vote of thanks.
Good afternoon. Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica. Honorable Dr. Irving McIntyre, Minister of Health, Wellness, and New Health Investment. Honorable Ian Douglas, Minister of Trade, Commerce, and other honorable ministers of cabinet, Mistress Letitia Lestrade Wyke, Permanent Secretary of Ministry of Health, Wellness, and New Health Investment, other permanent secretaries, Mistress Carrie Prince, Mayor of Portsmouth, Dr. Hamid Al-Kitid, Project Manager of MMC, Mistress Terrell Ravelier, Acting Principal Nursing Officer, Pastor Joseph Benjamin, other invited guests, member of the media, ladies and gentlemen. On this memorable occasion, I deemed it a great honor and privilege to deliver today's vote of thanks. Firstly, all glory and honor to the Almighty God for making today's occasion a success. We wish to express gratitude to the Prime Minister, the Minister of Health, Dr. Irving McIntyre, the Parliamentary Representative of Portsmouth, Honorable Ian Douglas and Reginald Ostry, Permanent Secretary of Health, Mistress Wyke, Mayor of Portsmouth, Principal Nursing Officer, District Medical Officer, Dr. Francine Jeffrey, and the other District Health Medical Team, the Portsmouth Health Team, and also the Cuban colleagues. Congratulations to Mistress Douglas. She was once my tutor at nursing school, and well deserved. Also, MMC Construction, also Robin Constructions, for this beautiful building. Isn't it beautiful? Indeed. Thank you very much, and it was a real need for Portsmouth. Also, would also appreciate the presence of the invited guests. Special thanks to Angel Joseph, St. John's Academy, the ushers, the media as well, the police, and the organizer. Last but not least, I would like to thank everyone for their attendance, their cooperation in making this function a resounding success. To God be the glory, great things He has done. Thank you very much.
Thank you, Nurse Andrew. And just between Nurse Andrew and I, when we worked on Winston Ward, many people would ask, are you all sisters? Our hair color, same thing. She had curls like me. And we would say, yes, we are sisters. And after we would have to confess, no, we are not. So thank you, Nurse Andrew. We now have a presentation of a fruit basket to Nurse Olivia Douglas. So our community health nurse, Nurse Brewster, will present the fruit basket to Nurse Olivia Douglas. I now invite the Honorable Minister, Dr. Irving McIntyre, and other Prime Minister and other members of Cabinet to view the unveiling of the plaque. We have two plaques. We have one which will be erected outside and one on the inside. Following the unveiling of the plaque, we'll have the cutting of the ribbon, and we would then invite Pastor Benjamin again to do the blessing of the facility.
It blinking. The ribbon cutting and unveiling of the new Olivia Douglas Health and Wellness Center, and of course that being done now in Portsmouth, Georgetown, Portsmouth. The facility has been officially commissioned, and the ribbon was cut by the lady herself, Mrs. Olivia Douglas. Mrs. Olivia Douglas is the wife of the former parliamentary representative for Portsmouth, the former leader of the opposition, Mr. Michael Douglas, and also she's the mother of the current parliamentary representative for the Portsmouth constituency, Honorable Ian Douglas. The plaque reads, "The Olivia Douglas Health and Wellness Center is dedicated to Nurse Olivia Douglas in recognition of her dedication and outstanding contribution to the health services nursing in the Commonwealth of Dominica, commissioned on March 1, 2020. Funded by the government of the Commonwealth of Dominica under the Citizenship by Investment Program." The officials are inside the building now, and they're getting a first-hand look as to what is going on here. And of course, Prime Minister Skerritt leading the way here as they look at the wonderful facility here in Georgetown, Portsmouth. And of course, we see the senior minister. We also see the Minister for Agriculture, the Minister for the Environment, and quite a few people, quite a few officials are already here and just looking as what is going on in the facilities down here. Hopefully we'll be able to speak with Mrs. Douglas herself, the person of honor here this afternoon, Mrs. Olivia Douglas. We will be able to get a chance to speak to her, hopefully this afternoon. And of course, we are here live at the commissioning of the new Health and Wellness Center, the Olivia Douglas Health and Wellness Center in the town of Portsmouth, in Georgetown, to be particular, in Georgetown, Portsmouth, here this afternoon. On Friday, we saw the commissioning of the Esprit Murphy Health and Wellness Center in Maho. It was the first of its kind. Currently, there are 12 of them being constructed in Dominica, 8 having been completed and 4 still under construction, namely Collyho, Ansdimay, Newtown, and Soufriere, still under construction at this time. And 8 of these facilities have been completed in Dominica, all part of government's effort to modernize healthcare in Dominica from the primary level upwards. We are seeing the construction of these health centers, but importantly, we're also seeing the remarkable investment in the construction of a over $40 million hospital in Marigot, as well as an over $100 million hospital, state-of-the-art new modern hospital in the capital of Roseau. Hopefully, very soon, we will be able to speak with Miss Douglas, the lady of honor this afternoon. Miss Olivia Douglas was dedicatedness in recognition of her outstanding contribution to nursing and nursing education in the Commonwealth of Dominica. And we see the several government officials who are here, led by Prime Minister Honorable Roosevelt Skerritt, who is just mingling with the people here, of course, observing the relevant protocols. Prime Minister Skerritt having taken his vaccine last week, and I believe quite a few people have already taken their vaccine here already. He announcing today that VACAS today, the vaccine process went to VACAS, where over 250 people were vaccinated here today. Prime Minister Skerritt there just walking around and just mingling with the people. Of course, another important ceremony here, we go to Bellevue Chopin on Wednesday, and then we go to VACAS on Saturday. I'm going to try to get Miss Douglas, but I think they're going on. They're going on there. Yeah. So, yes. So we're going to try to get Mrs. Douglas here, but they are going on to the upper part of this. The upstairs of this is the residential area for the medical professionals here, and of course we will seek to get some of that to you this later this afternoon. But this is where we are at this time. The official commissioning of the Olivia Douglas Health and Wellness Center in Georgetown in Portsmouth has been completed. The officials are just getting a tour of the facility at this time, and very soon we'll be wrapping up here in Portsmouth to take you back to master control. So on behalf of all of the people who made this broadcast possible, we look at Edward Philogen, who is our video editor and switcher, and our cameraman Ashton Shillingford, Albert Tusse, Anthony Richards, our production assistants Duzan Peltier, as well as Clyde John Baptist, and of course our man back at Master Control, Mr. Nigel Hippolyte. They were able to bring you this broadcast live here this afternoon. On Wednesday, we go to Bellevue Chopin, and on Friday, we go back to VACAS. We go to VACAS for the other commissioning. Next Monday, we will be in Wesley, and next Wednesday in Marigot. So on behalf of all of us here this afternoon, until then, you have a very good afternoon. We may take a few more shots of what's going on here, and if need be, I may be able to have a short interview with Mrs. Olivia Douglas here. So we'll be around still. We'll stick around for a little bit. Hopefully we are able to get Nurse Olivia Douglas, who is here this afternoon, and have a small conversation with her on her thoughts as to the naming of this wonderful facility after her. So we'll take in a few shots of the sites as to what's going on, and we will continue in a little bit. How are you? I'm good.
It's on now. It's on now.
No, don't put on.
Permanent secretary. Press secretary.
Yes. You ready, Silo? Okay, good. Yes, the mic on. Mrs. Douglas, congratulations. The Health and Wellness Center being named in your honor. How do you feel?
Very, very proud. I'm elated and I'm humbled to see such a prestigious building. Gone are the days when we used to make do at the Portsmouth Hospital. And I feel very, very, very proud. As a matter of fact, I think in this new building will stand a picture of myself holding a baby, a young lady from this very community. So I thought it fitting that they should put that picture there, because she too, not only she must be a grandmother by now, will have the use and benefit of a much, much, much improved facility to when she was there at Portsmouth Hospital. She was only about 2-3 years old at the time.
You worked in the service for over 40 years. You were a pioneer in the primary healthcare facility. How far do you think our healthcare system has come in Dominica?
Leaps and bounds. Leaps and bounds. I worked for 16 years at the Portsmouth Hospital as departmental sister in charge, and from there I was sent by then Dr. Dorian Shillingford to Barbados to pursue a nursing education program. Having returned in 81, I wanted to come back to serve my community in Portsmouth, but I was told that my services are now needed at the Princess Margaret Hospital School of Nursing, where I worked for some 12 years until the time when I couldn't anymore and I couldn't get transferred back to Portsmouth, so I had to resign. But it was a good thing because I did not only resign, but I took up another job as another profession as a director for the young people in Portsmouth, call center. And that, with all of that, all my skills of being a nurse and, nursing just came into play. Because I left the hospital, but I started with the adolescents of Portsmouth and its surrounding. So now here we have a beautiful facility where all of those services will be rendered. My hope and prayer, though, is that we have a counselor, nursing, psychiatric nursing, trained psychiatric nursing stationed at a facility like this, especially for our young people. We're talking about wellness, so we don't want to see them on the streets, our young fellas. We know what they're doing out there. So with this kind of service, someone there with that kind of background, knowledge and training, that can be taken care of.
What would you advise the young nurses in entering the profession at this time?
Well, a nurse, for me, I was mother, doctor, midwife, teacher, caregiver, you name it. And I think all nurses should have a spirit of empathy. Be there. Put yourself always in the patient's, position. I know sometimes it's difficult. Sometimes I manned that Portsmouth Hospital after Hurricane David. It took me 2 hours on a boat. I think it was Mr. Neville Wade's boat from Portsmouth to Roseau to collect medication because nothing could come by road. So I think I'm tired. I worked non-stop for at least, I think, 8 weeks, 2 months. With just relief and things like that. And then also for the 47-day strike when they had that. I was the only nurse on call, nurse sister. So these are you have to put yourself in the patient's position. When they need you, you're there and they can count on you.
Thank you, Ms. Douglas, and once again, congratulations.
Thank you so much.
Thank you very much.
I'm honored.
All right. There you have it. The words of Mrs. Olivia Douglas. So I think we can sign off at this time. On behalf of all of us, once again, congratulations, Ms. Douglas. On behalf of all of us at the Government Information Service, we return you to Master Control, and we look forward to the commissioning of the Bellevue Chauffeur Health and Wellness Center this Wednesday. Thank you.
That's Mrs. Josie.
Yes, that is Mrs. Joseph. Yes.